Hello, and thank you for joining the Systems for Action RESPROG webinar. My name is Chris Lido. I'm Deputy Director of Systems for Action. S4A is a national research program of the Robert Wood Johnson Foundation housed at the Colorado School of Public Health. We support studies across the country, testing tools and models to facilitate multi-sector collaboration across medical, social, and public health systems with the goal of improving population health and advancing health equity. Our RESPROG webinar series serves as a platform for S4A investigators to share findings at various stages of their studies and provide commentary on the potential impact of putting their findings into action. Today, we are joined by Drs. Melissa Johnson-Reed and Patricia Cole to introduce their new S4A study that investigates systems alignment of multi-sector agencies to address child maltreatment in St. Louis. If you have any questions for our investigators, there is a Q&A box at the bottom of your screen where you can enter those, and we'll have time for questions at the end. We'll start out with presentations from our investigators, followed up by commentary by Scenaria Salaiman. And with that, I will introduce our investigators. Melissa Johnson-Reed. Her work focuses on understanding how to improve the behavioral, educational, and health outcomes associated with childhood exposure to trauma, particularly abuse and neglect. She has a practice, she has practice experience in both domestic violence counseling and program administration as a school social worker in California, and currently provides evaluation consultation for state and community organizations. At the Brown School, Johnson-Reed is the chair of the Violence and Injury Prevention Concentration and the Master of Social Work program, and supervises an interdisciplinary violence and injury certificate, which involves collaboration with the Catherine M. Buder Center for American Indian Studies. Patricia Cole, her scholarship is focused on strengthening, implementing, and sustaining evidence-based interventions that improve the quality of care for vulnerable families. She's affiliated with 2 research centers at the Brown School, the Center for Mental Health Services Research and the Center for Injury and Violence Prevention. And Scenaria Salaiman is the Executive Director for Vision for Children at Risk. Prior to her current position, she served as the project director of Project Launch, a federally funded initiative focused on coordination and collaboration across family and child serving systems to improve child well-being. And with that, I will pass the mic along to our investigators.
Okay. All right. Okay. I think I have control at this point. Good morning or good afternoon, depending on where you are. And this is Trish Cole, and I'm going to start with an overview of the Parents and Children Together St. Louis project, which we refer to as PACT-STL. And then I'll turn things over to Melissa, who will review the Systems for Action Research and Evaluation Project, and then Scenaria will provide a brief commentary. We will end with an opportunity for questions. And I do want to say, if along the way you have a clarifying question, you can go ahead and enter that in the Q&A box. And I know it's a research in progress presentation, but we really are at the beginning of our project. I do want to note that. Oops. Okay, it's not moving. Okay, thank you. So PACT-STL is actually funded by the Administration for Children and Families with the Vision for Children at Risk in St. Louis as the grantee, and I'll talk more about VCR shortly. I actually lead the evaluation team with supports from the Center for Innovation and Child Maltreatment Research, Policy, and Training at the Brown School at Washington University in St. Louis. And so the ACF mechanism, the community collaboration, the community collaboration to strengthen families and prevent child maltreatment mechanism focuses mostly on funding programmatic efforts with a cap on resources for evaluation. So it's funding a process evaluation and a limited outcome evaluation. The Robert Wood Johnson Foundation, the Systems for Action funding, is actually allowing us to conduct a more comprehensive evaluation and to use innovative and advanced methods to really delve into how a community collaborative works to prevent child maltreatment and to improve child and family outcomes. We'll also actually be able to explore more in depth whether the realignment of funding mechanisms improves the system's response to the prevention and treatment of maltreatment, and preliminarily, whether it results in better outcomes. And I do want to clarify, for the S4A grant, the center is the grantee with VCR as an integral part of the project. So annually, millions of children are reported to CPS. And these children have much higher rates of both short-term and long-term negative health and behavioral outcomes, making child abuse and neglect a really critical public health issue. And I want to say, by the way, throughout much of the presentation, we use the shorthand child maltreatment to encompass all types of abuse and neglect. Now, when most people think of maltreatment, they think of the worst forms, such as sexual abuse, severe beatings, cigarette burnings, locking in a closet. However, the majority of reports are actually lower risk referrals, and Child Protective Service systems simply lack the resources to adequately address and adequately serve these lower risk referrals. Also, it's well documented that families that are reported to CPS present with complex needs. They're behavioral, they have health needs, they have concrete needs such as housing and food insecurity. And existing services are fragmented, they're difficult to access, and this adds additional challenges to families that are already struggling. So as a means to break down the service system silos and provide a more coordinated response, collaboration among community stakeholders has shown promise in addressing these service gaps. In response then to what we know, PACT-STL aligns services and funding and implements parent empowerment and public health strategies in an effort to prevent maltreatment and promote healthy development. So the overarching objective is to develop, implement, and evaluate strategies that prevent child maltreatment, that reduce entry into public child welfare, and to enhance the overall well-being outcomes for children and families. Now, there's a couple of key strategies. Now, I will say within each of these strategies, there's multiple strategies or activities that I'm going to touch on, but very, very briefly. I'm not going to go into detail about. But overall, we're looking to increase the capacity of our community to provide evidence-based services. We're looking to reduce barriers to existing community services by better aligning funding with the needs of families and then also influencing policy and practice changes. And it's through these systems level changes that we anticipate affecting change, that we'll see fewer maltreatment reports, we'll see fewer placements into foster care, and better overall outcomes for kids and families. So at the heart of PACT-STL is a community collaborative that brings together social service, public health, and medical agencies. Our partner agencies also include those that are both in the public and private sector. It's actually housed within social services with VCR as the hub. The Children's Division, which is Missouri's Public Child Protective Service Agency, is a key partner. as well as legal services, housing, public health, medical clinics, and child and family service agencies. And the partners that are involved at the start of the grant are listed here. And I will say that the goal is to increase the number of agencies participating in the collaborative as we move forward. I want to take a minute to talk about VCR. So the mission of VCR is to promote the well-being of children, youth, and their families with a primary focus on those impacted by socioeconomic risk and racial inequality. They aim to promote the well-being of all children through a focus on family support, early childhood development, quality education, youth development, maternal and child health, and safe neighborhoods and strong communities. They do this through advocacy, collaboration, data and research, and family and community engagement. In addition to being data-driven, they have extensive experience facilitating community collaboratives and bringing together agencies across service sectors. They're actually a perfect organization to serve as the hub for PACT-STL. So in addition to the collaborative, which is actually building off a long-standing multi-system collaborative in St. Louis that is looking to prevent child abuse and increase the safety of all children, St. Louis CAN, the St. Louis Child Abuse and Neglect Network, there is an executive committee. And a key piece of that executive committee is the co-chairs of our region's Family First implementation team is a part of that. So Family First is the latest policy impacting CPS, and just really in briefly. And one of the focus of these teams, which are actually required within the policy, is the realignment of CPS funding to actually provide services to families that may fall into that lower risk referral category, in an effort then from preventing them from moving into our higher risk, so coming back as a higher risk referral, and also to reduce entry into foster care. Additionally, it is a priority to ensure that the voices of parents with lived experience are heard are heard throughout the course of the project. And in VCR, in addition to hosting community cafes where we've already had the opportunity to hear from parents, there's a parent advisory council that will have representation on the larger council as well. The collaborative is, the role is to identify and address service gaps through consistent review of shared data. So the evaluation team will actually be using data from the Children's Division as well as from the partner agencies to assess how children and families are doing along the way, to assess how the project is doing, and that data will report it back frequently, and it will be used to inform how we're doing and to inform additional strategies as we move along. There is the streamlining of funding and identifying new and redirected funding streams, making policy recommendations, and sharing information from their individual sectors. So it's a cross-sector collaborative, and so representatives from the different sectors will bring the most up-to-date information about what's going on within their sector, so that any cross-sector decision-making is based on that decision. There's also a public health campaign that they'll participate in. So our catchment area is made up of 2 counties, which St. Louis City, which is a county in and of itself, and then St. Louis County, which actually surrounds the city. So there will be parent engagement, parent empowerment, and parent education strategies that are happening across these counties, with an emphasis then on those zip codes that have the highest baseline rates of child maltreatment reports. At the family level, there are multiple strategies that will be used. And I'm not going to go into detail here, but they are from very low touch to higher touch strategies, including being assigned a family mentor to help them navigate the CPS system. At the child and family level outcomes, we're looking to increase families' connection to the right services, looking to increase resiliency among families, and then ultimately reducing the number of new reports, reducing entries into foster care, and also a special emphasis on looking at racial equity in our short and immediate term outcomes. At the systems level, organizations will be trained to host our cafes. They'll be trained to facilitate evidence-based parenting programs. And the decision was made not to use funds to hire new staff, but to use funds to actually train existing staff in effective interventions that this helps with sustainability at the end of the program, that their staff will in fact be trained, and it's not that funding for a staff member actually ends. We're training representatives from organizations around cultural competency. Of high relevance to the S4A grant is the assessment of current funding streams and alignment of funding. Other activities are collaborative meetings and a joint strategic planning process to ensure that there's alignment across the systems, and those outcomes are around redirected funds that better meet the needs of families. We want to make sure that families are having access to the services that they actually need. Looking at policy and protocol changes at the state level as well as at the organizational level. As I've said, it's about increasing the capacity to provide services. We're looking at increased collaboration among the council members to make that a more meaningful collaboration. We're looking at then also part of the process, Children's Division has in fact agreed to have PACT-STL inform their strategic planning process as well. And so I think I've gone longer than I had intended to. I want to now go ahead and turn it over to Melissa.
So hello, everybody. I have the pleasure of collaborating with this wonderful project. As many of you may be aware, sometimes when these community collaborative implementation grants are made, there's very, very little monies available for evaluation. So this S4A project is really critical for us to be able to do a rigorous quantitative, qualitative, multi-level evaluation to try to really add to the knowledge base for this project. And Trish, you can go ahead and. So we have a very multidisciplinary team. I'm not going to introduce Trish and myself, but Dr. Atzimus is a pediatrician, and Ellis Ballard has a background in systems dynamics. Derek Brown is a health economist. Dr. Constantino is a psychiatrist. Barry Rosenberg is a professor of practice with multiple years of experience as a leader in the nonprofit sector. Scenario, of course, who we'll be talking to later, is the head of the lead agency. And then Nancy Weaver is a local consultant whose focus is on not only pediatric injury, but public health messaging and how we disseminate. So we've really brought together a group of people that can help us not just look at the multiple layers of this project, but also how these various disciplines are coming together to serve children, how we might be coding various documents and data in this project. And so we're very excited about the opportunity. We also have a long history of collaboration with each other, so that really enables us to move forward quickly. We've all worked together, we know each other, we've published together in many cases, and so this again helps us pull this together in a feasible way. The other thing that makes this project more feasible is that there were data agreements in place as part of the original PACT St. Louis, so even though there may not have been enough funds to analyze that data in the way we would like, we're starting with a lot of the foundations in place that we need, especially in regard to the administrative data to be shared. And that includes Children's Division, which is Missouri's name for child protection and child welfare, public housing, Medicaid, juvenile and family court, and various data sources from our community-based stakeholders. So we have 3 aims. We're examining the alignment of services and funding through content analysis of documents. We're using system science group model building with our leaders and stakeholders. We're doing a network analysis to understand how collaborations change over time, and then we're triangulating this with some of our parent stakeholder data, so that we kind of understand not only whether the systems believe that they're collaborating better, but whether the parents are also seeing this as well. Second, we're trying to understand possible community level change. So this is a widespread, as Trish explained, there's multiple activities from very broad community-wide to more targeted. So we really wanted to see whether or not we're going to be able to track changes at the target zip code level compared to other regional targets around child outcomes. And then we want to model outcomes at the parent level and then look at cost effectiveness by service use. So I am not going to read every single activity for this aim, but we did want to sort of highlight how we're using multiple methods, quantitative and qualitative, in trying to understand how agencies are aligning to better serve our families. We also wanted to mention that, of course, when Trish and Vision for Children at Risk got the grant, they didn't envision doing the grant in a pandemic, so we have added some COVID questions as well in our systems alignment. For AIM 2, this is really largely administrative data. So we're bringing together data on child maltreatment, foster care, and select health indicators, which our pediatricians are going to help us with. And then we're merging that data with census information so that we can compare data from target zip codes with data from other zip codes, both pre and post. I have a long history of use of administrative data, and others on our team are very talented in spatial analysis. You can go to the next one. Are we stuck?
Seem to be, there we go.
There we go. Okay, so AIM 3 really pulls it all together around outcomes. So we're going to both merge administrative data from participating stakeholder agencies to understand outcomes for high touch and lower touch families. Then we're also going to go out in the field and interview high touch families with comparison families outside the target area. So we're going to understand outcomes from their perspective around their child's health related quality of life, satisfaction with services, controlling for maternal ACEs and social support, and then we're also going to link these to state child abuse and neglect reporting data. And then our health economist and our expert in the nonprofit sector is going to help us with conducting the cost effectiveness analysis based on both what we understand from linking the administrative data in regard to services delivered but also on agency budget documentation and how they may have changed services or retargeted services for this project. So there's a variety of deliverables, which is also why this grant is so critical for us. We would not be able to do this without the RWJ support. We'll be able to do additional peer review and conference dissemination. We'll be able to do tailored reports for our parent cafes to support community capacity as the grant is being implemented. We have funds to provide capacity for policymaker briefs. Participation in opportunities like this would not be possible, so that we can learn from each other nationally. And also we'll be putting in elements as we go forward around replication design, depending on what our findings are.
So I want to.
Yep.
Oh, go ahead. Sorry. There was a comment in the chat around the Medicaid data, and we are working to get MoHealth data, which is our Medicaid data. So yes, we will have that data.
Yeah, it is specific to children in our state that we'll be looking for. It is more of a challenge if we were to try to get Medicaid data for adults. So progress, we're very early in the stages. We've hired staff. We received IRB approval for AIM 1 and 2. We actually split AIM 3 out, and we're going to do that as a second IRB because of COVID conditions. We don't really know what that's going to look like at this moment. We've already requested the state level administrative data for AIM 2, and the baseline stakeholder survey is about to be disseminated. So now I'm going to turn it over to Sanaria, who we're very appreciative of taking her time today to do some commentary.
Thank you so much, Melissa and Trish. Good morning, everyone. I'm very excited to be a part of this event today and to be working very closely with Washington University. As Dr. Cole mentioned earlier this morning, VCR is the grantee for the PACT-STL initiative. The title, as it was mentioned, the title of the funding was Community Collaboration to Strengthen Families and Prevent Child Maltreatment. So for us, the title really said it all from the very beginning. So we knew right away that this was something that we were very interested in and also very excited about. So we decided, even though VCR, we were very excited about it, we wanted to invite all of our partners to come to the table and just say, this opportunity is available. Is VCR the right entity to be the hub? Or if there is somebody else needs to do it, but we need to do it in collaboration because we do believe in collective impact. Of course, we brought everybody together, including Washington University, because for us and from past experience, your evaluation team can make or break your initiative. So for us, the Washington University Evaluation Center, with Dr. Trish Cole being the PI, we knew while this was a big decision, it was really an easy decision for us because they bring into the table not just the knowledge and the experience, but the passion and the heart, which is really important. So the purpose of the PACT-STL, as mentioned before, is really to develop, implement, and evaluate strategies to prevent child abuse and neglect. So based on that and based on conversations with the evaluation team and also all of our partners, we have decided on 3 main goals for this initiative. Number 1 was to reduce entry into the foster care by intentionally linking families to local community-based services early on, before they even come to the attention of Children's Division. This is, again, something Dr. Cole talked about. While we have a lot of great services in St. Louis, not every family have access to those resources. So we wanted to make sure we focus on that. We have staff on the ground in the community to make sure families are aware and connected to those services. Then we said, even with that prevention early on, even if there are families who are in the attention of Children's Division having a family assessment, we will make sure that those families are prepared with a parent mentor. And these are families with lived experiences who have gone through the system before, and now they can serve as a mentor for these families who are going through this similar situation. So this is really all to focus on the caregivers, the protective factors, and also to reduce the risk factors. Goal number 2 that we wanted to focus on was to support the overall well-being outcome for children, youth, and families, including change in the risk factors. And then goal 3 was, of course, to develop strategic collaboration with all of our partners to coordinate and monitor the outcomes across multi-sector partners. So basically increasing sustainability by identifying potential funding streams and better aligning them to meet the needs of the families, but also increasing collaboration just in general amongst the council members. So again, doing all of those work, of course, there are many different components. We wanted the evaluation team to work very closely and hand in hand with the program team. So the evaluation component then would be the needs assessment, process evaluation, outcome evaluation. The outcomes for the system level, as Dr. Cole also mentioned, was to increase capacity of services, also increase collaboration. For the families, the outcome would be increasing the protective factors, which we do all of our CAFE works around that, making sure it's all around strengthening families, using the protective factors as key ingredients to strengthening families, but also at the same time, making sure that our families are connected to the resources that they need, but also to decrease the risk factors. Again, for us, from past experience, choosing the evaluation team is a big component of the work that we do. So we are very excited and pleased to be working with Washington University, the Evaluation Center, specifically under the leadership of Dr. Cole. That's it. Thank you.
Thank you so much to our investigators and for a commentary as well. This study is newly funded and has just started, so we really look forward to all the findings that come from this study, especially as you all have to navigate this fraught environment. So we have some time for a few questions. I do want to give folks a few moments to add any additional questions they may have to our Q&A box. So we'll start with a question from Mac McCullough. I will direct this to anyone who wants to take it. It's a multi-part question, and I do want to to remind folks that this is a new study, so there won't be as much progress to speak to. Excuse me. So Mac asks, can you talk more about your cost effectiveness portion of your analysis? What perspectives are you using? I.e. societal, payer specific, and are you anticipating being able to cost out all of the program's benefits? And are there any anticipated barriers?
So Derek Brown, who is our health economist, was not able to join. So I'm going to do my best to pinch hit because he would be the best person to respond. We are not imagining that we're going to be able to cost out every single component. So as Trish mentioned, there are a variety of things from community-wide all the way down to very targeted services. So we plan on focusing the cost effectiveness analysis on families that we know are engaged directly in services at the sort of coaching, mentoring, cafe type level and the more intensive parenting level. We are mostly focused on the child abuse and neglect and health outcomes as the dependent cost outcomes. And Dr. Brown was part of the CDC team who did the cost analysis of the long-term outcomes for child maltreatment. So he has experience in looking at this. Probably will be limiting our look of costs to those systems for which we have administrative data.
Okay. And Melissa, I'll direct this next question to you. How long is the grant funded for, and is there a sustainability process in place for the future?
So our Systems for Action grant is funded for 3 years. The PACT St. Louis actually extends longer. So the timing of these is a bit staggered. The PACT St. Louis, and Trish, you can jump in here and correct me if I'm wrong, has a pre-implementation phase, sort of a needs assessment phase, and that's being wrapped up now. And then they will move into implementation, and that is right as we are starting. So we won't quite, unless we are gifted with an extension, be able to follow PACT St. Louis all the way to the end.
Yeah, and then built within PACT St. Louis is sustainability, and that's why some very purposeful decisions were made at the beginning around how do we increase the capacity in a way of our community to provide these services in a way that is sustainable. The realignment of funds, that process that we go through is really, will be done so with the lens of making sure that these funding streams are actually sustainable. So that is built into the grant, with S4A being 3 years, PACT-STL being 5 years. We want this work to extend beyond. Another one of the other reasons that we chose an existing collaboration, the St. Louis Indian group, is because they were already in place and have a long-standing history, and so the hope is that they will be able to continue this work without the support once the grants end.
Thank you. And Trish, we have a question from Jeff Whiting. They would like to, they said, I'm curious what the hypothesized mechanisms are to engage and connect families who may be wary of prevention services. How are frontline practitioners trained to keep families connected after they are approached by the program?
That is a fantastic question. And one of the, we're still early in the process, but one of the key findings from our work with parents so far, with our community cafes, has been around trust, and that there are some there's a lack of trust between the community and between our CPS system. And so there will be a series of there will be a process that we undergo to include parents in those conversations, because we're going to have to, we absolutely will have to look at how do we increase the trust between our community and our systems, so that there is increased willingness to participate in the services. One of the key strategies around that at the programmatic level is the parent mentors who are families or who are individuals with actually lived experience within the Child Protective Service system that will help families navigate that system. And the goal is around increased trust, but also increased connectivity to services.
And if I can add just a tiny bit to that, Trish and I have had the opportunity to do some research in the community before, Trish with older kids and myself with infants and preschool age, with families that are involved with the child protection system and linking them to services in the community. And one of the operating factors in this has been the ability to actually provide services. So we've actually found that when we have services and connections to offer that are of interest and acceptable to the population, that there is actually an eagerness to participate in services, and that sometimes the perception that families that are involved in child protection don't want to engage is at least in part because a lot of the families that don't receive intervention, as Trish discussed earlier, with sort of not the very, very serious needs, haven't really gotten much except for that investigation contact, and then people just leave. So I do think it's important to have those mechanisms in place, but I also think it's important not to assume that families who have become engaged with CPS in some way are not amenable to participating in services when they exist.
Thank you, Melissa.
Thank you both. This next question is from Jean McGuire. It's a great idea to get children, families to engage children and families earlier in their challenges. Many times services are not equitably available to these families as eligibility related acuity thresholds are high. Yeah. How will you address this challenge?
So that is one of the key priorities of PACT-STL in looking at both within families that have not yet had contact with the system, but also those families that Missouri has the differential response. So they have both families can be go through a traditional investigation, or they can be diverted to family assessment. In diverted families, as Melissa talked about, and as I said, sort of those low resource families have traditionally not gotten services. And so in working closely with Children's Division, those diverted families that go through family assessment will have the opportunity to be connected through services to services through the grant. The also, as we're looking at funding mechanisms, the hope is to begin to divert more of the funding that went downstream into upstream services, so that we're actually preventing we're preventing maltreatment versus waiting until they're in the system and in foster care. So there's both programmatic and then some funding and policy shifts that we're planning to target.
Thank you. And I know earlier you all listed some of the systems alignment aspects of your project, of your study, could you speak a bit more to how you plan to measure systems alignment?
Sure. So we're actually doing this from multiple viewpoints. So we have a stakeholder survey that's about to go out that asks a series of questions that'll allow us to gauge what those networks of those providers are currently, and then be able to see how those change over time in a systems network analysis. We are looking at family perspectives, so focus groups from parent cafes on whether or not they're seeing the changes. So we're kind of doing ground up and top down. At the same time, we're collecting the documents from all the various meetings associated with PACT St. Louis. So not just sort of minutes, notes, but also asking agencies to give us internal documentation of changes that may have occurred in meetings or executive decisions around how they are interfacing differently with each other. And then we'll also have administrative data from the agencies that are participating in the services themselves with the more targeted services. So we'll actually be able to see if families are moving across the various systems as their need suggests. And then finally, when we're looking at outcomes, we'll be asking questions about services satisfaction and whether or not they were able to get what they needed, not just whether or not they saw changes in their child's well-being and their own family. Does that answer your?
And there will also be, we are also collecting data on how the agencies are funded, how they allocate those funds to services as well. Yeah, so it's coming from multiple data sources.
Yeah, because it's actually a complex question when you think about alignment, not just on a piece of paper, but how it works on the ground. And we wanted to make sure we documented this sufficiently so that if the outcomes are positive for families, that other organizations can look at this and sort of understand how it happened, not just what happened.
And I want to, Scenario would like to speak more to the role of parents. So I want to give her the opportunity to do that. Scenario?
Oh, thank you so much, Dr. Cole. So I know there was a question previously about the role of the parents. So I wanted to make sure that that was really clear for us with Vision for Children at Risk. The family engagement is a big component of what we do. So part of our prevention was to hire staff from the community so they can go out in the community, talk to parents, and invite them to parent cafes, which basically the parent cafes focus on the protective factors. So bringing families together, using those protective factors in everyday life, but also at each event, families will have the opportunity to be connected to resources. We will provide many, many resources at each session. Right now, just because of COVID, those cafes are happening, of course, virtual via Zoom, but even via Zoom, we're still making sure that staff stay at the end of each cafe to make sure we listen to our families' need and connect them to resources, because we are using the parent cafes throughout St. Louis City and County to really focus on prevention. And if we have families who have the assessment, again, we will make sure our staff who have lived experiences that they really then reach out to families to make sure they walk them through the system, basically from their own experiences, but also just this partnership that we have developed with Children's Division. So once a family they have a family assessment and Children's Division assign a caseworker to them, then that caseworker will work very closely with our family support partners and our parent mentors in order for the two to really help that family to take advantage of the resources, but also if there are any parenting classes that we can connect those families to. So it's really all centers around that family engagement piece.
Thank you.
In scenario, are these families mandated to be part of the services if referred by the Department of Family Services?
So right now, they're not mandated. That's a really good question. We have our partnership with Children's Division. We have sat down and really talked about what this piece should look like. And Children's Division, they acknowledge that because of past experiences, and I think Dr. Trish Cole talked about this earlier, there is that lack of trust, and our Children's Division, they acknowledge that. So part of the work and part of the partnership is that then we will have our parent mentors to follow up with those families to kind of serve as that bridge to really help with that building trust. And then basically talking to the families about the importance of following through with the Children's Division recommendation. So it's really more of a partnership. It is not a mandate.
Thank you so much. And how do you identify families at risk?
So again, we will basically, at the very beginning, when we talked about our focus is going to be St. Louis City and County, we will have staff to go out into the areas that we know for a fact and from data, but also past experience, we will go into the community that nobody else is going to, or we know families are not receiving services for many different reasons. So that is going to be our target area, target zip code, to talk to families, to invite them to, again, this is really with the prevention level, to invite everybody to come to be part of our parent cafes. As part of our needs assessment, which we had 10 months of planning period, we offered community cafes, and that was part of the needs assessment, to bring families to the table and just say, we are very interested in hearing your voice and learning from you to see why child abuse and neglect is happening. What did you go through? Why is the system not working? What can we do then to help you? So we brought families to the table to talk about all of those pieces as well, just to make sure we are responsive, and anything that we do, it is based on the family's voice. So we do a lot of outreach, a lot of one-on-one, even right now during COVID, when staff cannot go in the community just right now, we do a lot of phone calls, one-on-one outreach to talk to families so they can be part of this initiative.
Thank you so much, Scenario. That was really helpful. We received an email question, and I will preface this again with the fact that this is a new study, and they're pretty early on their studies, and there aren't lessons learned to be shared yet. I will say, they will be presenting in the near future once they do have more results. But from the email, they're asking what actions from cross-sector collaborations made the biggest dents in prevention efforts, and what were lessons learned that other regions could heed. So I guess a way to adapt that question is, what actions from cross-sector collaborations do you anticipate will have the biggest dents in prevention efforts?
So, and yeah, we don't have lessons learned. We clearly don't have lessons learned yet. But in our measuring sort of collaboration and the collaborative efforts in multiple ways, but I would suspect it will come down to having a shared strategic vision, having sort of the willingness to realign funding that will have the biggest impact. That moving the collaborative from simply coming together and reporting what each agency is doing to really having a shared vision, shared goals, shared activities. Scenario, do you have anything to add to that?
I think you said it very well, Trish.
Thank you.
Well, Trish, thank you for being a good sport and answering our hypothetical. And with that, we're going to go ahead and wrap this up with a few announcements. I really just want to thank Doctors Trish Cole and Melissa Johnson-Reed for sharing their study and for a helpful commentary from Scenario Suleiman. For folks who would like to receive a certificate of completion for today's ResProc webinar, there will be a survey at the end of the session that will be, and there will be one email to you as well for you to fill out, and we'll get that certificate of completion to you as soon as possible. If you're interested in learning more about Systems for Action's studies, we'll see you again August 19th, same time. We'll be hearing from the Systems for Action's intramural research team led by Dr. Glenn Mays, who's also a director of S4A. And they'll talk about how multi-sector community networks are shaping COVID-19 pandemic trajectories and outcomes across the US. That'll be followed by our first September webinar, which will be led by our University of Delaware team, Dr. Daniel O'Connell, and he'll talk about testing the impact of a referral program to link probationers to primary care. This is one of our older studies, so really looking forward to catching up on their findings. And with that, we'd like to thank the Robert Wood Johnson Foundation and for making this possible. And we appreciate all of your participation and look forward to joining us August 19th. Thank you and take care.